right, hello. Welcome to the Butterflies podcast. This week we have a returning guest, Ava, who is going to share with us the results of her research project involving how to better support TS patients. So, Ava, tell me what were you hoping to find when you started this project?
Hello. So again, thank you for having me again on your podcast. And in the beginning of my research, my main goal was to find, things that Turner syndrome patients found uncomfortable and things that they didn't like and wish that would be changed about the diagnostic process and how doctors ultimately communicate with the patients. And I think I definitely found that through my research.
Okay. So how many people in total did you end up questioning for this project?
It was pretty hard to find willing participants. So I only got about 20. But it was enough to generalize my information, like generalize the results and say that this could be, represent a majority of Turner syndrome patients.
Okay, and what did you end up finding after interviewing everyone? What were your results?
So my results, when I was analyzing my data, I found two major topics that came up, which were awareness and resources. So almost all of the 20 participants stated that they feel that primary care physicians, like specifically, don't have enough knowledge on Turner syndrome to effectively communicate and make them feel comfortable. And then for resources, funny enough, um a lot of people talked about Turner syndrome camp. They said that they should have um like pamphlets and ads and stuff like that in doctors' offices so parents don't have to find resources like therapy, Turner syndrome camp support groups on their own, which could lead to more stress.
Definitely. I agree with that. A lot of Turner syndrome, like, it's not that well known of a condition, and the only time I've, like, seen it talked about really was through my biology class. So I definitely agree with you on that.
But I think it is important to note that I actually interviewed a cardiologist, like the heart specialist, and he was saying in medical school it's a topic of discussion, but some cardiologists specifically, I can't speak for all specialists, but cardiologists specifically, some don't even see Turner syndrome patients, so all the information that they know can kind of just fade away. Like endocrinologists, it's really their job to know about stuff like Turner syndrome, so I feel that this doesn't apply to them. But definitely primary care physicians and other specialists who don't necessarily need to see or as common to see Turner syndrome patients.
Yeah, one thing that Grace and I talked about last time I saw her was how spread apart Turner syndrome care is, because it's like you have one in LA, you have one in Boston, but like if you are like me and you live in the Pacific Northwest, it's extremely hard to find proper care.
Definitely. Me and Maddie had also talked about how they only do like really certain age groups, like one for like little kids and then one for like older women, and there's really none for like in between like the teenage years and like young adult years. And we think it's important to kind of focus more on that, making sure there's support in that age range.
Yeah, I'm lucky because me and my other friend Michaela, who lives in Utah, I don't think she's ever been on, but I live about 30 minutes outside of like this really big children's hospital. that like TS patients from like, because I'm in Utah, like Idaho and Arizona and whatnot will go to too sometimes. So I'm really lucky that I live so close to Caleb, and I know it's not the case for a lot of other people.
Yeah, I'm also personally very grateful that in Colorado there is a Turner syndrome clinic, and I think it sucks that there's more places that don't have that. Like again, when me and Maddie saw each other the other day, he said that he doesn't have as much access to like that kid. I definitely feel like we need to talk more about getting access for everyone to have good health care and what Turner syndrome is.
So, kind of going back to what Maddie said, especially, I agree. Like, healthcare all throughout the United States, it's so different, and access to medical care, just in general, could be pretty hard depending on where you live, and especially Turner syndrome, like Turner syndrome care. Like, I know I live in New York, so it's not too hard to find to get specialists, because it's a very known state, like New York, California, versus if you go to more remote areas, if you have Turner syndrome, there's really no saying if you're going to get proper care where you live. You might have to move, which is not fair.
This is coming from someone who lives in California. It's not even like, even in California, your access to healthcare can be extremely restrictive. Like, I live in NorCal, in the middle of nowhere, Yolo County, and there's no heart clinic or any like technician stuff in around where I live, so I have to drive an hour away to a place called Roseville to get my heart test every single year. And it sucks because they used to have a heart clinic and stuff, but not a lot of people were using it because, rural area, not a lot of people have heart conditions and stuff. So they didn't need it, and they replaced it with another unit that was more needed. So because of that, like, restrictive healthcare, I have to drive an hour to a different town.
And that's saying something. You live in California, and the fact that you have to drive an hour away, like the fact, like, not even that you live in California, you should be able to not to drive like at most 30 minutes away. Like, that shouldn't be able to happen, that you have to drive an hour away. And that's really something that I was trying to find, like, that's not okay. And I actually found that a lot of my participants, like, there was one lady, she had to go to a different state to see her doctor for like
That's
2
insane.
years of her life. I know.
Yeah, me too. I have to go up to Washington. That's the nearest one for me.
What state do you live in?
I'm an Oregonian.
Oh, but I think it should be healthcare for everyone, let alone people, patients with Turner syndrome you should have access to it, especially if you have a condition like Turner syndrome where you need to see specialists.
And with Turner syndrome, there can be so many complications. Like personally, I have like a heart murmur and like the clock of like the aorta, and it's like if you don't get your heart checked, you could be like in serious danger. And there's so many girls out there who probably have that.
Yeah, exactly.
Exactly. So imagine somebody who lives in a very rural town and they don't even know they have Turner syndrome, they have something wrong with their heart, and then something happens to them. They have to drive like an hour or two out to see the nearest doctor, and that should have been discovered years ago, and it could have been prevented.
I agree, and the thing that gets me is I wasn't the only person in my town with Turner syndrome. During my freshman year, there was a senior, her name was Gale, amazing girl. She also had TS, and she was, like, worse off than me. Like, her leg didn't even form correctly, so she had to wear a prosthetic leg. Me and her are unable to get the help that we need because of where we live.
Yeah, kind of like what Sophia was saying earlier about how you said you live in like a ruralish kind of town?
Yeah, so I don't want to dox myself, but
Yeah, of course.
I live in Yolo County, California, which is a very rural county. It's, especially in the town that I live, it's very limited in healthcare. We have, like, one health clinic that is, like, a small health clinic, one eye doctor, and that's it. And the nearest emergency room is 15 minutes away, that you have to drive by highway. Like, me and my brother, we were both born in different towns away from the one we lived in. Like, my parents had to drive like 25 minutes to give birth to me because there wasn't any clinics at the time. Like, there was nothing, and there still is basically nothing.
Yeah, it's kind of like in New York, the closer you are to the city, or like, yeah, the closer you are to the city is where, most of the, where, life is basically. And I'm from Long Island, so it's pretty close to the city, but if you were to go upstate, it can get pretty rural. And so I know a few people who live upstate, and they have to drive hours. Like New York, like upstate is huge. Some people drive like 4 hours to go down to the city just to see their doctor each year, because some towns don't have adequate doctors.
Exactly, like, especially in rural communities, like, our stuff is very limited. And I can confirm this. I've lived in a rural town my entire life. Like, there's, like, it's one of the things, like, if you mess up, everyone in your town's gonna know about it. You have limited health care. We even have limited options where we get our food. We only have, like, 2 grocery stores for the entire town, and the produce in both of them isn't that great or that healthy.
Another thing I feel like we should talk about is it's not just how far you have to drive. Even if you end up driving like that 3 hours, you might not be going to a clinic that is able to specialize in Turners or knows what you actually need, because the awareness and the information is just not out there all the time.
It isn't. And when you like research Turner syndrome, they give you like the worst case scenarios. And it's like that's not what a typical Turner syndrome patient actually looks like. They just see like the worst stuff.
Right. Like, for me, being on estrogen and getting on it was a fight because my endo was like, you're low-key fine, and I don't know what I can do to help you because you don't really need help. And I'm like, this is so not true. I haven't had my period in 2 years. This is not okay.
And like back to worst case scenario stuff, like families who are like a mom who's currently pregnant with a daughter with Turner syndrome, that's like terrifying for them to see the absolute worst case scenarios possible if that's all the information they're getting because their doctor doesn't know enough about it.
Yeah, and kind of speaking on awareness, actually, one of the solutions that came up a lot, and I just want to I think this should be a topic of discussion, is an increase in learning about Turner syndrome in medical school. And what do you guys think about the likelihood of this happening and how effective it would be in increasing the awareness of Turner syndrome, especially in primary care physicians whose job isn't really to diagnose Turner syndrome?
So a couple months ago, I was like doing all my college application stuff, so I had an interview with Harvard. And the dude who was interviewing me was like a dermatologist or something, and he was asking me about something, so I was like, oh, I have TS, because, pro tip, milking off your college apps works really well. But I didn't say the name, I just said I only have one X chromosome. And he said, oh yeah, Turner syndrome, right? And I was like, whoa, because I've never run into that before, ever. And he must have heard about it in med school or something when he was studying, so I would say that's a great plan.
Okay, that's actually so cool, though.
I think raising awareness in primary care physicians is super important because, like, people like me go undiagnosed for 14 years and end up getting severely sick from not having the right treatments. And if primary care doctors know what to spot, it can be caught earlier on.
Oh, for sure. I actually was diagnosed by a med student, ironically enough, so I definitely think that is a good solution.
Me too. I got diagnosed by a nurse practitioner student.
Yeah, and actually, there was one response in when I was conducting my interviews, and one lady said that it's not the primary care physician's job to, like, directly diagnose a person with Turner syndrome, so why should they have more schooling? And I thought that was very, like, I didn't want to say anything rude to her, but that was a very interesting response.
All right, so we are nearing 20 minutes, so is there any final thoughts? I mean, anyone wants to say any, like, last things they want to bring up for discussion before we end this? Mary, I know you haven't talked a lot. Same with you, Sarah. Do either of you want to get some words in?
Yeah, I'd just be really curious, Ava. I know you've sort of touched on this, but did you find any like concrete solutions in your research that you thought could actually work? Like I know increasing knowledge of and instruction about TS in medical school was one thing. Was there anything else that you heard a lot of these women saying would be helpful?
Kind of like what I said earlier, for awareness, I thought that this would be the most effective in increasing the amount of resources that Turner syndrome patients have, and kind of reducing that stress on parents to have to find resources on their own, like Turner syndrome camp, like like therapy or support groups, and it was kind of just having those, having pamphlets, ads in doctors' offices with contacts to various resources like the ones I mentioned just now. And I think that would be the most effective, because when you're waiting in the waiting room and you're sitting and you see a table full of pamphlets, ads, newspapers, a parent could be drawn to them, reading them, and is like, I think this would be a good fit for my daughter, to help them feel more comfortable with their new diagnosis, and to know everything's okay, meet other girls with Turner syndrome.
Yeah, that was actually one thing that Ava sang on my mind I wanted to touch on, is I think that we cannot understate the importance of giving endocrinologists to know about camp, especially like after those other resources, because most people who know the diagnosis see those healthcare professionals, so if they know about it, then they can spread them a little, and that's like a great like starting point for the diffusion. Because I heard about camp at the conference, which is another thing, in 2018, but I don't even know how we heard about that, and we would have never heard about the camp if we hadn't gone to the conference. But if my endocrinologist had known, then she could have told us about it, and it's a whole thing. So yeah, I completely agree and think that'd be a awesome idea.
Yeah, and there's actually one more thing I wanted to bring up that I thought was pretty interesting. There was one older lady, and she said that out of casual conversation, she brought up that she gave her doctor her number and is like, hey, if you see any new girls with Turner syndrome, give them my number, and I'd be happy to call. I'd pick up the phone. I'd pick up the phone and I'll answer any questions that they had, and I'll just support them through this new journey of their life. And she did not receive one call, not one call, and she believes that her doctor never gave anybody her number, and this was about 4 years ago.
I think some of that might be, it could possibly be violating HIPAA, which is patient privacy. So
yeah, that's what I was thinking too.
Yeah,
because,
me too, because I don't think they could legally do that. But I mean, there has to be some way that he could sort of just like put her number out there, not like saying it to them, if that makes sense. Just like having it. I can't explain it. I don't know how to put this in words.
Something where if they like consent to share that information with this person and talk to them, then they could still be in touch.
I think it would need to like a lot of like red tape and like document signing and stuff.
Yeah, I think there has to be some way, because I think that would be such a good resource for newly diagnosed girls with Turner syndrome.
Yeah.
Because that would give them somebody to talk to, comfort them, guide them.
Yeah, I really hope that woman does get calls, because unfortunately, like, doctors, because they're legally bound to, they do not play about HIPAA. Like, there are websites now where you can leave doctor reviews. They cannot even respond to any of those reviews that are left about them because it violates HIPAA. They can't do anything to violate it, or else they could be like in serious trouble.
Yeah, any healthcare professional, if they violate HIPAA, they can get their license revoked or get fired.
Well, I think that's all we wanted to talk about. Thank you, Ava, for joining and for like being here many, many months ago at the start of this and being here now. And I think that's the end of our episode. I hope all of you guys have a great day, and bye!